So, I mean, we've been talking about pain specifically. I did read up that there was already other VR use cases, right? So like anxiety, depression. I think you even had one example of PTSD, where VR is able to kind of deal with that. Is this a trend that we'll be seeing? Will VR be able to maybe not solve, but certainly significantly impact many of these different kinds of problems that we'll be seeing over the course of the next, say, 10 years or so?
Yeah, I think that I think the well is bottomless. In terms of, so just the PTSD, we worked with the Department of Defense in the United States to help build simulations that help battlefield veterans overcome PTSD. We've worked with other patients as well, but you know, so the issue there is that people, the therapy is based on what's called exposure therapy. It helps the soldier kind of gradually revisit the traumatic experience. One of the scenarios is you're driving in a Humvee through a generic Iraqi city, and there are stressors. There are IEDs, explosions. There are, you know, shadowy figures. There are, you know, sort of attacks and things like that. And the therapist can control the amount of the intensity of those stressors. And then by encountering that in a graded way, the patient can recount, relive, and come to terms with their own traumatic experience. Very effective, works well. You know, it's another tool for the therapist. So a great example of how, you know, VR is not just necessarily a bottled, you know, a packaged thing that the patient does on their own. It's a tool. And if it's created with the right mindset and sort of creating the right capabilities, it can really open up new opportunities for the therapist to access those kinds of, you know, traumatic experiences. So, you know, I think in the future, what the potential is that, you know, in therapy, you know, people are using VR for not just pain, but for, you know, neurological conditions, for one of the classic things that is the phantom limb experience. Ramachandran did this amazing work, you know, using mirrors to reduce pain for people who had lost a limb. So you can see your this hand superimposed on where this hand would be. Right. Using kind of those premises, not exactly doing mirror therapy, although people are trying to do that, but using ways for the mind to change the physiology. I think that's a very fertile field. Changing the way that medicine is practiced, such as the PTSD example. And I think the other thing is that we're going to see the economics of health and the demographics of population mean that there is increasing stress on our health system, and this is global. We have an aging population in most countries, and the United States is particularly, the baby boomers are coming to the age where they're going to need more and more and more services. The health system can't deal with that. So we need ways to shift therapy out of the hospital, out of the clinic, into the home environment, help people be more healthy in place, because we just economically can't afford to just build more and more hospitals and train more and more doctors. And then, you know, with the bubble, when the bubble goes, then you have a problem on the other end. So I think the big promise is that VR can kind of offload some of these different kinds of therapies, and also change, create new therapies that will solve long intractable problems.